Hello everyone, my name is Victoria Hebert and I'm here to address the issue of the growing fentanyl overdose crisis. As future nurses, it is important for us to become aware of raising health concerns like this one. The news article from CBC published by Hernandez on August 31st, 2021 highlights the importance of safer drug supply and overdose awareness as the COVID-19 pandemic has sparked an overdose crisis. Let's take a look at one of Canada's provinces on the West Coast, British Columbia. According to CBC, from January to June of 2021, over 1,000 people died from drug overdose. And between April and June, there was an increased number of cases from extreme fentanyl concentrations. Chief Coroner Lisa Laponte explained that the leading cause of death for people ages 19 to 39 is drug toxicity, and the majority of these people are males. The BC Coroner Services explained that in 2019, only 8% of drugs tested contained fentanyl, but in 2021, this percentage has gone up to 14%. Brian Twaits is an advanced life support paramedic specialist who explained that they would usually respond to 12,000 overdose cases a year. But after the pandemic, it has risen to about 365,000 cases a year. Fentanyl is a top drug contaminant on the streets, and as nurses, it is important that we raise awareness about what is going on, understand the philosophical approach, think about our cultural considerations, and how we can fix this problem as nurses.
Hello, this is Elas. I'm going to give a brief summary of two peer-reviewed articles on fentanyl overdose. In the first article, Matt Diaz states that fentanyl is a powerful synthetic drug it uses to treat patients with severe pain, for example, patients with terminal cancer. Since fentanyl is cheap to produce illegally and efficient to transport, it can be used to infect other less potent street drugs. Most of the time, victims of this drug overdose believe that they're just purchasing narco or other kind of strong painkillers. It also has been suspected that drugs smuggled into Canada and US from China through Mexican drug cartel. In the literature, some ways are mentioned to confront this epidemic. We as nurses also have to consider these options. First is to improve the system of monitoring prescriptions. Means that lack of post-discharge monitoring should be taken more serious. Second is to improve overdose treatment access. For example, in Canada, paramedics, firefighter, and police are provided with an overdose treatment called naloxone. Lastly is that public health agencies and medical professionals should reduce the need of fentanyl and other opioids by prescribing safer painkiller and improve and monitoring approaches to these medications. The second article by Boyd and colleagues indicates that Vancouver, mostly East Side, has a very high rate of fentanyl overdose deaths. Sex workers and clients' interactions also affected by this overdose epidemic. Also, risky environments such as injecting and sex work locations, illegal income, and poverty would be some reasons leading to this epidemic.
This is Janusha, and I'm going to be talking about the philosophical approaches that were used by the journalists. Taking a look at the first article titled Fentanyl Overdoses in North America, we can acknowledge that the journalist Matt Diaz has incorporated the social justice approach in their writing. The journalist writes about the relationship between mental illnesses and the opioid crisis and brings light to those that are most impacted. Matt Diaz raises questions that make the readers think when they say, is it possible that the individuals seeking the street drugs have developed an addiction that stemmed from legally provided prescriptions? The journal is also suggesting positive changes and advocating for benefits to improve the health of those being impacted, such as improvements to overdose treatment. The social justice framework enhances the discussion because it goes deeper than just what the issue is. It looks at potential resolutions which can lead to a new perspective of thinking. Now looking at the second article based around sex work, the journalists have incorporated the critical social theory by focusing on one of the most vulnerable groups. They also incorporated the phenomenology approach by interviewing those directly impacted. With the information collected, Lavallee et al. Have found the majority of participants reported regular illicit substance use, and half the participants had experienced at least one opioid-related overdose in the year prior to the interview. The journalists also incorporated information on the underlying issues that further impacted the problem and have focused on the intersecting barriers to reporting overdoses to law enforcement and medical services. Many of the participants had mentioned their fear of police violence and stigmatizing encounters. Lavalier all specifically mentioned Indigenous people who fear that the police may engage in colonial practice where they drop Indigenous people off in isolated areas during extreme weathers, leading to deaths. These fears could increase the number of deaths due to overdose. The critical social framework enhances the discussion as it exposes the underlying issues of the society, which makes room for new opinions and understandings to form. The phenomenology approach also enhances the discussion because it allows for a deeper understanding of the struggles and barriers that participants have experienced, which gives a better understanding to the purpose of the journal.
Hi everyone, my name is Shanique and I'll be talking about cultural considerations. After the CBC News article that we presented, it highlights drug overdoses in British Columbia, but does not specify the groups that are most affected by it. When discussing the issue of opioid overdose, and more specifically that of a fentanyl overdose, it is important to know that this is something that affects a wide variety of cultures that includes white, Indigenous, Black, Hispanic, and many more, which really shows the severity of the issue and how it is a problem that is not limited to a specific group of people. This presentation, I will be touching on that aspect to further dive into this issue in relation to Black communities. Banks et al. 2021 states that overdose rates have significantly increased amongst Black individuals, and the COVID-19 pandemic has made these circumstances even worse. Although there are many drugs that are causing overdose rates to increase, including cocaine, heroin, among countless others, fentanyl is shown to be the main cause of overdoses within Black communities, as stated by Penaloza 2021. In Canada itself, there has been an overprescription of opioids in which people have been obtaining them through legal and illegal means, which means through pharmacies, family members, drug dealers, or their internet, which has ultimately resulted in them being used for non-medical reasons, leading to addictions, as stated by Penn 2020. Although the drug itself is a major issue here, there are also many factors that have to be taken into account when looking at fentanyl overdoses within the Black community, such as the barriers that they face. Penn 2020 states that this includes the stigma surrounding Black individuals and drug use, limited access to treatments and care, and lack of educational resources that provide information on drug use and its repercussions. The association between drugs and Black individuals automatically brings about the stereotype that involves illegal relations such as dealing drugs, which diminishes the seriousness of this issue, so that there needs to be systems put in place to help aid those with addictions, rather than taking on a pessimistic point of view when looking into this matter. This also relates to limited access to treatments, as they may not have the means to obtain opioid treatments such as naloxone or buprenorphine, along with the specific care that they need, as stated by Penaloza 2021. Lastly, there comes a point of education and whether or not the awareness of the effects of fentanyl is widely known amongst this community. Without proper educational resources, individuals will not be aware of the repercussions that come with drug use, which contributes to the increase in opioid overdoses. This is such an important aspect of nursing, as cultural awareness and considerations have to be taken into account when delivering care to patients. Nurses must ensure that they are able to provide benefits to those individuals and marginalized groups to adequately meet their needs and carry out efficient care.
My name is Xander, and I will be presenting the nursing implications portion of this presentation for the fentanyl overdose crisis. Nursing implications refers to what the nursing profession can do to combat this health crisis. One possible way that fentanyl overdose can be combated is through education within schools about the dangers of overdose, as well as providing students with the tools to know what to do in a situation of overdose. If a student were to ever encounter a family member or friend that has overdosed on fentanyl, they will have the tools to know what to do in this situation and can help save a life that would have been previously lost due to lack of knowledge on the situation. Another way to lower fentanyl overdose is through reducing accidental overdose through unknowingly consuming of fentanyl-laced drugs. This is seen in a study completed by Goldman and their associates, where the use of fentanyl test strips was tested among drug users in Rhode Island. If nurses start to explain how to use fentanyl test strips to at-risk communities and handed them out at a low cost or free of charge, this can prevent accidental overdoses by individuals being able to test their narcotics for fentanyl content. A third way that nurses could lower drug overdose is through educational supervised injection sites that are monitored by healthcare providers, such as nurses. Nurses can explain clean health practices when injecting so as to prevent infections, and knowledge and awareness about what narcotics users are consuming and the effects of consumption. Gagnon states Canada has safe injection sites but often lacks supervised injection sites, as well as found data from other countries that supervision by healthcare providers decreases instances of overdose and spread of bloodborne diseases through educating and helping individuals that access this service. A final way that fentanyl overdose can be combated is through distribution of naloxone kits and education by nurses on how to use them. This nursing implication can have large impacts on overdose through providing life-saving education and resources to at-risk communities. Overall, it can be seen that the majority of suggested nursing implications are focused on targeted education and providing the nursing profession as a source of help and access to communities at risk.
Here are our references, and thank you so much for listening.